Hello everyone, for this video I'm going to be performing a respiratory assessment. So the first thing I'm going to do is just assess my scene safety. I can confirm that the scene is safe. I'm then going to consider appropriate PPE for the scenario, which I've done. I'm also going to gain consent from the patient and just make sure that the patient is sitting upright and is comfortable. So Olivia, are you okay if I just do an assessment of your chest? I'll have to palpate, feel around different areas and just ask you a few questions. Are you okay with that?
Mm-hmm.
Yep, excellent. Okay, so I've got consent and the patient is comfortable and sitting in an upright position. Okay, first thing I'm going to do, I might just tilt that down so that we can see the patient. The first thing I'm going to do is just give my general impressions. So, for example, I'm going to be looking at the position of the patient. For example, is she tripoding, or does she have the ability to maintain her own posture? Which you can see here, she's quite comfortable and she is maintaining her posture. I'm going to determine if her breathing is tachy or bradycardia, and I can confirm that it is just normal at the moment. Her ability to speak. So, Olivia, can you just tell me your name and what your favourite subject at school is?
My name's Olivia and my favourite subject is going home.
Okay, fair enough. I didn't know that was a subject, but very good. I'm just going to look at her skin colour and I'm also just going to feel for her temperature. I can see that she has some rosy cheeks and that she does feel a little bit warm to touch. There's no presence of cough. There's no presence of a cough and I can't see any mucus or anything. I'm also going to consider the environmental factors. Just looking around, there are no asthma puffers. She doesn't seem to be on any medication. The environment actually seems quite safe and stable, so I'm quite happy with that. Moving on to my inspection, I'm just going to consider if her breathing is laboured, and I'm also going to see if there's the equal rise and fall of the chest, which I can see that there is. I'm also just going to have a look just to see if there's any scarring or bruising or any trauma to any part of her, which there's not. That's all fine. And I'm also just going to listen for equal vibration. So can you just say 99?
99.
And again?
99.
Sorry, say 99.
99.
Say it again.
99.
And again?
99.
And I can confirm that there is equal vibration across the back there, so which is very good. Now what I'm going to do, I'm just going to palpate for pain and tenderness. So I'm just going to go across the back. Any pain?
No.
No across here, any pain?
Yep.
Oh, any pain?
No.
No, okay. Just sit up straight a little bit, please. Any pain down here?
No.
And down here?
No.
All right, we'll just have a look at the front. Any pain?
No.
No, down here?
No.
And down here?
No.
Okay, no
No.
worries. Okay, thank you for that. What I'm going to do now is I'm just going to percuss in 6 places, and I'm just listening for hyperresistance. So, and at the front here. No, that all sounds fine. And finally, I'm just going to oscillate in 6 places. So 3 at the front, 3 at the back. And as I do that, I'm going to ask Olivia, oops, I just need to fix this up. I'm just going to ask Olivia if she can take deep breaths as I do that. So I'm listening for symmetry of sounds here. Okay, deep breath. Deep breath. Deep breath. Deep breath. And I'm going to repeat on the back. Deep breath. Deep breath. All good. Deep breath. And deep breath. Yep. Thanks, Olivia. All right, so what I'm going to do is just share that information with the patient, explain my findings, and see where we go from there. Thank you, Olivia.